Hello, everyone. You're welcome to Early Intervention Matters podcast. This is a podcast platform that discusses issues regarding neurodiversity, and we do lots of talks on different topics relating to neurodiversity. And today we're really pleased to have a guest on our show who I was very fortunate to have met on a virtual platform recently. We connected, and I was really pleased to and inspired by all the work she's doing. I'm going to get Gazit to introduce herself, to tell us a bit more about herself. So thank you so much, Gazit, for joining us on this show.
Yeah, sure. It's such a joy to be here. Thank you for having me. As you mentioned, my name's Gazit Chaya, and I was really excited to see the work that you're doing on your podcast to share information with parents and families about how much we can do when, especially in the early years, to support kiddos. I'm a person who now works with neurodivergent folks, but also have had my own journey to understanding myself through a lot of trials and tribulations along the way, especially some early head injuries in my first 3 years, and not during a time when there was any early intervention or understanding of how powerful that could be. So I'm really delighted that we're talking about these things now, that we're educating folks, and just so happy to be a part of it.
Thank you so much. Thank you. And you've got a background as a speech pathologist. You said you trained as a speech pathologist. So, what does your work as a speech pathologist entail?
Right now, I'm focused on working with neurodivergent folks, some children, some teens, mostly adults. And we're working on understanding how the autonomic nervous system, the sort of fight, flight, freeze, fawn response works, how we can come into relationship with that process. We can't control it because it's autonomic or automatic, but how we can understand it, support, and respect it so that we can understand some of our behaviors and support ourselves in having more resources during our day to go towards those things which are really meaningful and important and values aligned for us, and understand what may be interrupting our access to those things in terms of our nervous system regulation. And I'm really pleased to be able to use a modality called the Safe and Sound Protocol, which is based off of polyvagal theory. And it's a music program that is passive and influences the nervous system's flexibility and tone in a way that doesn't require cognitive decision making, which can be really powerful for those of us who are neurodivergent or have significant trauma in our background or maybe nonverbal. So it's a really accessible tool, and I'm really delighted to be able to incorporate it into my work.
Now, that's really interesting, and would like to hear a bit more about that program. In the UK, when parents are meeting a speech and language therapist as part of assessment or therapeutic interventions, they're usually quite fixed on what they're expecting. They think it's to do with just improving the child's language. Parents want to move the child from non-verbal to verbal, which is usually the main focus. So how do you explain in your affirming approach to them in parent-friendly language? Because for a lot of parents listening to this, it's going to be quite interesting for them to learn about this approach. So how do you explain that to them?
So I have found that it tends to be the most beneficial to work first with the parents rather than starting with the child. In that way, I can be a support to the parents in their understanding of their goals for their child and how those goals might be more aligned with some stereotypical or ableist is another word that we could use models for what makes for a good life. Really grateful for the neurodivergent people who have come ahead of me, those people who have worked to get rights for autistic adults and disabled adults, to acknowledge that a meaningful life doesn't have to look the way that our society says a successful life may look. and that everyone is able to build a life that's meaningful for them. Thankfully, we're starting to get really awesome research around understanding autism and ADHD and all types of neurodivergence as a difference rather than a disorder. In the world of speech pathology, we crossed that hill, in the last several decades around differences in language. So they used to see a English language learner, for example, in a English speaking school be put into special education as having a learning disability.
Mm.
And now, thanks to that beautiful work of multilingual speakers and advocates, we understand that those kids don't have a disorder, they have a difference. And that's what we're seeing coming into the world through the work of these amazing neurodivergent advocates. So, that is my perspective that being nonverbal is not a disorder, it's a difference, and that people who are nonverbal can have meaningful lives. And we can partner with children and adults to offer them access to communication tools that are meaningful to them. So it's really child centered, child led, within the context of focusing on offering a child the right to develop a meaningful life for them, not necessarily one that looks successful according to society, and supporting parents in the grief work that's often important in understanding and accepting who your child is, that they may not live the life that you expected or wanted for them, but that doesn't mean they can't build a life that's really meaningful for them.
Thank you so much. I think you've made some really important points because as a clinician who's been practicing for a long time, majority of the families I see um, are very worried because they feel the child is not meeting the societal expectation. Child is not speaking or chatting or talking like, another child in the school. And so they get really distressed and worried. Like you said, that kind of takes away from the very meaningful life that the child could go on to live because there's all these expectations around the child. So I think that work you're doing is really good. And like you said, you work with parents first to help them know because there are lots of positives and great things that nonverbal child is doing. And I've seen that in my clinical work as well, where there are lots of children who are nonverbal, but they do fantastic things. And it's trying to shift them from saying those things and not the language delay. So, yes, you've made really key points from there. And when you're having a session with families, what does it look like in practical terms?
So we're joining in with whatever the family is experiencing at the moment. Sort of historically in the we want to look like a good family model, parents try to have their kids show up in a more regulated state, looking like they're doing what they're expected to be doing, and parents can be really trying to suppress their kids from expressing themselves or having tantrums or any of that. I'm sure you've seen a lot of that go on. And so I really invite in, hey, if everybody's screaming and crying, just turn that computer screen on and let me be a part of it. Because what matters to me is what's real in their lives. A performance that, may last for 20 minutes is not going to help me really understand what the family needs support with, what the kid needs support with. And so I like to get very curious. Let's get in there. Let's be in the middle of Legos getting thrown and parents haven't slept in 3 nights and they're at their wits' end and nobody's eaten. And we just bring it down to the very basics. Give the kid a chance to have those pressures and expectations released for long enough that their nervous system can come back down. That might mean the kid gets to go jump on the trampoline for a while. It might mean the kid goes and gets a stuffed animal or a blanket. It might mean they take a bathroom break or get a snack. And we'll spend a lot of time checking in around what does your body need? Not just the kids, checking in with the parents. What does your body need? Have you had any sleep or food in the past 48 hours? Let's go get you a snack and I'll hang with the kid for a minute. So, getting those very basic needs met is incredibly important to the nervous system. We cannot learn until we feel safe. And if we have to go to the bathroom, or we haven't eaten, or our pants are squeezing us, or our, headphones are hurting our ears, then we're not going to be in learning mode. And so, as we say it with the listening program, safe before sound. And for me, it's really safe before anything. So, a lot of those early sessions, like I said, are me meeting with the parents, really understanding what's going on for the parents, what they're afraid of if their kid doesn't meet these expectations, what personal loss it may be for them, exploring their grief, and then opening up to the kids and letting the kids see that this is gonna be an environment where they don't have to perform. My number one rule is they get to tell me when they need a break. That's the
Mm,
only one rule that I have, is they get to tell me when they need a break. And we have a phrase, it's your capacity, it's not your character. And so we talk a lot about, if I've just hit my parent, if I've just destroyed my sister's Lego, if I've just refused to go to bed, it's not because I have poor character. It's because I had limited capacity. And how do we release some of that blame and that shame that can happen within families and start to understand what that behavior is really trying to communicate?
you're right. It just brings me to a child I saw this week, and I think before the consultation, the parents had been very worried about how the child was going to behave in the consultation, and had been asking and asking. I said, "Don't worry, we will see how things go. We take it in a very calm way." And I noticed parental anxiety throughout the consultation. So little things the child was doing, parents were very stressed to try and normalize those behaviors. And I kept on saying, don't worry, just let the child be. And this is what happens on a day to day basis when families go out, they go to the shops, they go to school, take the child to school. Parents are constantly worried about, just what you've spoken about. And so it's quite interesting, that approach about let the child be. And I like that phrase, that capacity is not character. It's just how tolerant that you are at that moment, and
Yeah.
your nervous system. Yeah.
Yeah, I'm so grateful that you're also providing opportunities for parents to have new experiences of not being judged for their kids'
Yeah.
behavior. It's still pretty rare. There still is a lot of judgment in society
Mm.
about how kids are supposed to act and how parents are supposed to control their kids'
Yeah.
behavior. So it's a
And
gift to your families.
I think some of the educational systems do not help because they put that pressure on parents.
For
They
sure.
exclude the children from school because they say we can't cope with the
Yep.
child.
Yep.
And then that puts pressure on the parents. Do you see this in your
Absolutely. And then it not only isolates the kids, it isolates the parents.
parents?
Absolutely. Yeah. It is very common around here as well. Even in my synagogue where my family attends, there are a couple of families that have kids that are not going to sit quietly through an entire Shabbat service. And there isn't really an option created for them to be a part of the community in the way that they are. And that is something that certainly we have a lot of room to grow in our society.
Yeah.
We have the medical model of disability, which says, please fix yourself so that you can do the things that we're all doing. And then we have the social model of disability that says, let's change society so that I can be me and not be shunned or told to
Yeah.
change. And so that's really what is so important to me on every level, is to communicate to parents, you're not doing anything bad or wrong,
Yeah.
and to communicate to children, you're not bad or wrong, because that's what
Yeah.
children hear, that they are
Yeah.
bad or wrong.
And that just fits a lot of children that are now very anxious and completely refuse to go back to school. And I
Right.
think it's that trauma, that repeated trauma at school of their experiences as well.
Absolutely.
And I think that there needs to be a lot of education for schools, for the teachers to understand, this new affirming approach, and then the fact that it's not about fixing the child, And I'm glad you
Absolutely.
brought up the faith aspect. I did a podcast on faith and neurodiversity is one of the sessions I did, and it was bringing out this same thing about how faith places of worship many times have not taken on board the neurodiverse child and just thinking about their needs and thinking about if that child dysregulates during the service rather than excluding the child, what have they done proactively? So, I'm glad you brought that up as well.
And not just children, it's adults too. I was recently at our synagogue, and there was once a month, there's a special service that's led by a different leader, and they wanted everybody to sit in a tight, close circle. But sensory-wise for me, I could not be wedged between these 2 large men who they, like, ushered me in to sit next to, right? And I couldn't take the noise, it was just very loud and packed in, and there were bright lights, and I had to awkwardly say, "I don't wanna sit with your group." They had taped off access to the other seats, and so I was considering leaving, and then there was an usher who I appreciated offered me to sit in the very back in a space for myself, but it was quite clear that the leader was upset about my choice to do that, and it's something that is not widely understood or supported, certainly.
Yeah. Interesting. So when we look at again, just thinking about programs that are offered for children, say with autism who dysregulate, a lot of it is behavior based programs. It's interesting that sometimes they have several sessions of these behavior programs. They have it in rolling sections, and yet it doesn't sort out the problem. But when we have meetings and we're trying to say, actually, don't blame the parents. Don't say you're sending them on 10 parent training programs because what you're doing, you're trying to fix a child. You think that by sending them on repeated programs will fix the problem. So this is part of the challenge we have because it's just one way that people look at things. You know, how do you convey this new affirming approach? How is it different from the other therapies that focus on fixing? Because those therapies focus on fixing behavior or trying to make the children more normal.
Yes, so I'm really glad you brought that up. Applied behavioral analysis is something that, at least in the States, is considered the gold standard still in public education and through most medical models. And unfortunately, the creator of applied behavioral analysis is the same person who created conversion therapy. I don't know if you're
Oh,
familiar with
yeah.
conversion therapy, but it makes sense in such a way. I was a person who, when I came out as queer, I was sent to conversion therapy, and the idea is we're going to make you not queer by behaviorally rewarding those behaviors that are acceptable and punishing those behaviors that are not acceptable. And it's the same model when it's used with autistic kids. It's to reward those behaviors which are considered acceptable and punish those which are not. And often it does not work because we cannot change a person's inherent wiring. You may be able to scare them enough or reward them enough to temporarily perform a behavior that's considered more acceptable by that analyst, but it's not going to change the actual wiring of their nervous system and their brain function. That is a part of who they are. In the same way that we can perm our hair, it can have a temporary shift, but when it comes out of our head, it is going to be back to our original hair design. It's a part of our DNA. It can't be treated, it can't be fixed, and it's not broken. And again, that brings us back to the social model of disability versus the medical model of disability. So, for a lot of parents, they do not want to work with me because they would like to change their child to fit this societal form of acceptability. And I'm very honest that that's not something that I'm offering. And, I recently had a parent say, "We have no evidence that your type of therapy is going to make our child a functioning member of society." And I said, "You are correct. That is not my goal. I am not trying to make your child into a different person who can do these things that are considered functioning. I'm interested in creating a world where we can care for each other and celebrate each other with what we bring. And any parent who has a child with a disability in their heart of hearts is able to acknowledge what a bright light that child is in their life and how there is an inherent contribution through that child being themselves. They may not be out there making billions of dollars and graduating at the top of their class, but there is contribution that is of value. And diverse societies are something that has been shown to benefit all members of society. So it's not the popular belief, and it's certainly not the one that's going to crank out more factory workers, as it were. But it is something that I really am grateful to say is growing in terms of the way that scientific research is supporting this understanding of neurodivergence being a difference rather than a disorder.
Yeah. Definitely, that's so important. Thank you. And what are some of the helpful strategies when you're working with families? So, what kind of examples do you take them through with their day-to-day routines?
Yes. So the number one starting point for parents is to take care of their nervous system first. Their nervous system is the priority. If they are going to try to offer co regulation from a place of dysregulation, it's not going to work. So I like to remind parents that when we are in any type of defense state or fear state, we're in our lower brain. And that lower brain has the cognitive skills of an alligator. So picture yourself as an alligator when you're scared, when you're tired, when you're hungry, when you're lonely, when you're irritated. Picture your child as an alligator and then proceed accordingly. So if I'm an alligator and I don't want to bite anybody, what am I going to do? I'm going to take myself to a separate space. I'm going to take care of myself. I might grab an ice pack, which is a really nice strategy. Using ice on the face or the wrist or the neck can bring your heart rate down without you having to cognitively calm yourself down. So I might grab an ice pack. I might take a few laps, get some movement so that my nervous system feels like it's being supported in what it's asking me to do, which is fight or run away. And I would take care of my nervous system as the parent first before I try to intervene with the kid. And then with the kid, I'm coming to them once I'm back to being a human, which is my frontal lobe, right? So if I'm upset, I'm not going to be sending language my kid's way. I'm not going to do that until I'm back to my human part of my brain. And then I'm going to be doing things like, you know, clearing space so that the kid is safe. If the kid's hitting me, which is a concern for a lot of parents, I might bring a pillow in between me and the kid. I'm going to take care of my own body. If the kid is hitting other children, same thing. I might create some space around them. And then we're going to just be a loving presence and use as little language as possible. Language is something that alligators don't do very well with. It confuses and upsets them. And I might put out an ice pack. I might put out some snacks. I might put out, a beloved toy or stuffed animal. Just sort of create some options without telling or forcing the kid to access them, letting that nervous system ride the wave of what the nervous system is designed to do. And then later, when we've come back into equilibrium, I might try to understand the child. I might think back of what that morning looked like, what the night before looked like. Did that kid not get enough sleep? Is there some discomfort with clothing? Is there some hunger? Is there some digestive stuff going on? Which we know that pain, discomfort, sensory overwhelm, digestive issues are more prevalent in neurodiverse folks.
Mm,
And so, what can look like a tantrum may
mm.
be actually an expression of pain.
That's great. That's really good practical strategies, and I'm sure lots of families listening to this will find this very useful. Sometimes families find it very difficult to communicate. For example, families going through the neuroaffirming approach, they find it difficult to communicate that with the school. Do you ever help them? Do you Do you support them in being able to speak to school?
I haven't played the role of being like an advocate for a family within a school meeting. It's something I certainly did when I was working in schools. I was 15 years in public schools, and that was part of why I became pretty unpopular was because I was advocating for children and families rather than for the school district. Something I like to remind parents when they're talking about the schools is that the schools are not interested in creating, unique child affirming practices. They are designed in such a way that they really need everybody to get in line and be a factory worker. So,
Mm,
yes, it is frustrating. And there comes a point at which we have to acknowledge what is. And for those people who have the energy to do a lot of advocacy, I am so grateful. And for those who are just overwhelmed and might need to make the decision to get their kids some alternative schooling, I really, support that decision because trying to get the school to change can
yeah,
be incredibly
yeah.
expensive, time consuming, emotionally draining. It can be a really difficult battle, and not everyone has those resources.
That's absolutely true. And I see this in my practice as well, where parents have become exhausted with battling the system constantly because it impacts on them, impacts on their work, impacts on the whole family. And they're constantly having to fight with the school literally to get the support the child needs. And a lot of children have become burnt out themselves from that process. So thinking of an alternative is really something that many parents need to be supported to consider. Do you sometimes have parents going through the safe sound protocol before and also going through the regular therapies? Do you have parents doing both?
Yes, I don't require people to not be receiving the traditional therapies. I certainly encourage parents to consider, to just be curious about and investigative about what are the outcomes for their child and how is it affecting their child and their family. But it is not a requirement that people are not engaging with those things. Certainly, what I tend to see as maybe a arc of the experience of doing this work is folks coming back into alignment with what is honest for them versus what is perceived as acceptable by external authorities, and grappling with some of that grief and radical acceptance that is necessary for processing that your child or your family are not going to have the experience that you may have thought was fair or good or right. That process of being a parent, embedded in that is the heartbreak that you can't save your child from all pain and suffering,
Mm,
and that you may not be able to create the life that you dreamed of when you were
mm.
young due to systemic oppression, personal disability, financial issues, child's disability, what have you. And that there's some radical acceptance to be had around I may not get to have the things that I thought I needed in order
Mm.
to have a meaningful life. And again, I'm a little repetitive with it, but shifting from trying to create a successful life into creating a life that's meaningful for you, is typically where people end up
Yeah.
heading towards in this process because they get to see that it may be that, they are going to have less financial resources in order to homeschool their child, or they're going to, have to end a relationship because the parenting styles are too different, that they may have to have their child in a public school that's less than ideal because they don't have the personal capacity to have them at
Mm.
home. Just sort of getting away from those perfection models, those acceptable or successful models, and coming back to what really is, being honest about what you have to offer as a parent and being honest about what your child has to offer as a kid.
It's very true. Thank you.
Mhm.
And when we've been talking about this, I'm just thinking through that parents really do not have time to process that grief.
Yeah.
Following the diagnosis, it's almost they go on the, hamster wheel and just continue. So they've not really had time because they're fighting for things for their child, and they've not really had time. Professionals haven't had the time to sit down and discuss. When the parent comes to the clinic, everybody's centered about what next for the child. It just brings it home that people really do not see the grief and what challenges the parents are going through. So I quite like the model where you said you start with the parent first, because you can't give from an empty tank. So that's really important. Thank you.
Hmm.
And do you see differences between cultural acceptance of this, the different cultures and people from different backgrounds and beliefs? What do you see?
Absolutely. Just because you asked that question, it's clear that you are aware that our historical reference point is very impactful and something that I spend a lot of time with my clients, whether they're children or adults, is deconstructing these ideas of good and bad, right and wrong.
Mm,
Culture is meant in an ideal way to support us and create belonging and to create meaning. But unfortunately, because we live on a planet that includes pain and suffering along with joy and pleasure. Embedded in there is this protective mechanism of culture that can tend towards control. And so when culture starts to control us and control whether we can see our own worth or the worth of our children, it can be incredibly painful. And again, we're going to face grief. We're going to face the experience of losing belonging and connection with people who may not have the capacity to open their hearts to consider differences outside of the expected cultural norms. And that's going to be different across every culture, the specifics, but it's
mm,
going to be a unifying factor of all cultures is that there is a norm that is conveyed to be right. And when we go against that just by having a child with a disability, because it's pretty across the board that ableism is going to be present, we are going to be challenged with being that outsider. And what does that mean for us as an individual? Without calling it anything religious, there's a spiritual aspect that we're invited into when we have a connection with someone or within ourselves not being able to do what is acceptable. It's
mm,
an invitation into saying, if I can't win, why am I here? How can I
mm.
create meaning? How can I still see my value and my contribution if I can't be, successful or acceptable or good according to these societal definitions? And it's a complicated process for people. And like
It
you
is.
said, starting with the parents is a way that I have found that their distress around their child doesn't have to change much if they start to address that
Mhm.
grief and that pain.
It is. And I think, again, in my clinical work, one of the most painful things I see is when I've had a few families where they specifically said they don't want anybody outside them to be informed of their child's diagnosis, including their parents or anyone. And I just found that very difficult. And I've said to such families that it's hard for me to continue because I can't be seeing a child in secret. Like that child is a part of that process. And it can't be that I start using coded language or pretending.
Yeah.
They need to embrace this and they need to get the rest of the family. But I have seen that strongly in some cultures where they do not accept that at all. And I think that also places some dilemmas for parents, because on one hand they want to support their child, on the other hand they want to align with the norm which we're talking about. It is.
It's so complicated, right? I really can appreciate how you would feel like that doesn't align with my integrity to
Yeah.
be operate in secret. One of my favorite poets, Audre Lorde, I don't know if you're familiar with her, but she calls difference just the only thing that makes you different from me is that we're afraid of different things. And we live in a legitimately threatening world.
Mm,
There are cultures right now where having a child with a disability, that child would be immediately killed or sent away, right? It's in our very recent history that they had the ugly laws in the US where if you were outside of your house and you presented as disabled physically or cognitively in any way, you would be fined, put in jail, put in an institution. So this is recent history. And this stuff is in our DNA. And these parents are legitimately scared. There are consequences to naming and supporting
Yes,
and even, let alone celebrating and affirming their children. There may be financial consequences, there may be religious consequences, there may be families who might get completely cut off from resources, love, connection. And so these parents are really faced with something incredibly challenging. So again, it sort of goes back to why I choose to work with parents first, because really there's so much that a parent has to go through to be able to be there and fully present for themselves, let alone their child. So it's so layered, it's very complicated, but my heart really goes out to these families who are struggling with
it
that.
does. It does. And that's why we have these conversations because, as a clinician, one of the reasons why I started doing this was I realized that in the clinical medical model, we hardly have the time to discuss these things. We're following diagnostic process, diagnosing children, and then it's the what next, what next, what
Yeah.
next. And we never had the time to actually look at things in a holistic way. And there are many families, because of the lack of knowledge and awareness, do not understand these things. So part of what I hope families will gain from this conversation today is actually understanding, like you said, everybody has something to contribute. Everybody's life is meaningful. Your child, your nonverbal child, your verbal child, it's a difference. It's not a disorder. It's not preventing them from doing the things. They have something to contribute. And I just hope that, people listening to this will be able to take that on board. So for parents listening who are new on this journey and feeling scared about their child's communication, what is one thing you would want them to hold on to today? What would you like to say to families?
Well, first of all, I would encourage folks to find a place to connect around their fear and their pain and their confusion and their grief. It may be that they can't find it in the clinics. It may be that they can't find it in their family of origin or sometimes even in their faith communities. So I would encourage parents to find, thankfully, online, we have a lot of these places for parents to connect and to reach out and find those voices of other parents who are going through what they're going through and also voices of neurodivergent adults who are living meaningful lives that may look different. When I was a young person and realizing that I was queer, I had no idea that someone who was queer could live a meaningful life. I thought I was just going to be in the gutters being spit on. I really did because I had never been exposed to that. And once I got into, I think it wasn't until really my 30s that I started realizing that there were beautiful, meaningful, amazing humans who were living full lives and contributing and finding joy and connection. And so there are thankfully a lot of beautiful autistic adults who are sharing their stories. Some are sharing them via AAC, which is augmentative and alternative communication. Many of them are adults who are nonverbal and living really meaningful lives. Verbal communication is one form of communication, and there are many other forms. In my time in schools, I specialized in AAC, and it is often daunting for parents. But thankfully, again, there are a lot of resources online of people modeling how to use these in partnership with the kiddos. If you have an AAC device that has been given to your kiddo, don't leave it at school. Bring it home, learn it alongside your kid, make it a game, an exploration. If you don't have an AAC device, bring in pictures and visuals and nonverbal ways for you to communicate with your child and for your child to communicate with you. So it's not just talk, talk, talk at a kiddo and then have them pass you a card for what they want. We're going to do it from the adult to the child and from the child to the adult. It's a really respectful way to communicate with someone. Noticing where you might be wanting communication behaviors to make your life easier versus where you're encouraging communication behaviors that might give your child more access to joy and things that are important to them. It's a easier place to start for a kid to tap into what they're excited about. So if they like water, if they like dinosaurs, if they like, the color blue, give them ways to communicate around those things that are really meaningful to them and use that as a bridge towards the things that are meaningful to you. Because if you just want them to tell you when they have to go to the bathroom, that's not very meaningful to them. So, for us neurodivergent folks, everything's about our special interests, and we need that as much as we need sleep, food, and water. So, if we love dinosaurs, we need to spend several hours a day thinking and communicating about dinosaurs. So, really leaning into what lights your kid up, and using that as a bridge, and then getting support for you just as a parent to process that grief and to open up to imagining new futures, new possibilities for your kiddo.
Fantastic. So you've answered my next question, which is about practical things families can do. Um, in terms of being both realistic and affirming. I think for families listening to this today, if there's one other thing to take away from this, is to be realistic about what you've gone through, what were your expectations, and where are you now. Then seeing your child in the light of, what they can contribute. And but I think that's when you can release that energy to begin to support your child positively. So I really hope families listening will take this on board and be able to walk through that process. But what do you recommend in terms of working through, the grief for families? What are your suggestions?
Yeah, consider your background first. Not everybody feels comfortable with seeing sort of a traditional counselor or therapist. If that is something that works for you, then I would encourage that, finding someone especially who's specialized in the complexities of parenting a child with disabilities. But if that's not accessible to you or you don't feel comfortable with that, there are often support groups that you can attend either in person or online. There's often crisis lines in the US. We have a 988 number, which you can call at any time just to get some support and validation. There are 12-step groups, which are free and available around the clock pretty much now that since COVID, we have them all online. So there's lots of ways. It could be through your faith community that you could access a leader of a faith community who might be willing to do some counseling with you, or look at creating an opportunity for you to connect with other parents. There's
Yeah.
lots of options, but basically, the two things that we know are needed to process trauma are safety and sort of a restoration of safety, and then empathetic witness. So we need somebody who's going to offer us their nervous system, who's going to say, "You make sense. I'm so sorry that you've been through this. I'm here with you." Not someone who's going to provide us solutions, not someone who's going to try to fix it or make us feel better, but someone who's going to validate and sit with us and be with us and acknowledge us. So it's tricky because for parents who, like we've acknowledged a few times, who are parenting, safety is hard to come by. There is a lot going on. So I'm a big fan of dialectical behavioral therapy, which is not targeted to neurodivergent folks, but is a very cool combo of cognitive behavioral therapy and Zen Buddhism. And one of my favorite skills uses the PLEASE acronym. And this is the one I say to everyone: if nothing else, do PLEASE every day, which is treat your physical illnesses, take your medications on time if you have prescribed medications, go to your doctor's appointments, prioritize that for yourself and your kid, eat regularly. You wouldn't believe how many people are not eating every 3 to 4 hours, which is a necessity for our physiological functioning. Our nervous system is going to go into defense mode if it doesn't get food every 3 to 4 hours. So, eating regularly, avoiding mood altering substances. So many of us are getting through by taking substances that are going to affect our nervous system again. Sleeping regularly, So many people are operating on no sleep. Take those kids to a trusted caregiver overnight once in a while and get a full night's sleep, and then move your body regularly. So many of us are not moving our bodies regularly. Those 5 things can make the whole universe seem better just by focusing on those 5 things. In 12 steps groups, they have a phrase called HALT. If you're hungry, angry, lonely, or tired, stop. Don't do anything except meet those needs. And that is a first line of defense for folks to get that a little bit of safety. You don't need to feel totally safe, but you need to feel safe enough. And that's really about taking care of your animal body. So take care of that animal body and then see if you can connect yourself with a therapist, a counselor, a clergy member, a trusted friend who's going to validate, not try to fix, and be with you in your suffering.
Amazing, is it? We could go on talking. It's just everything you said is just, I just keep thinking about the families I see. I think about, the challenges they go through on a regular basis, and everything that you've said just resonates. I look at the families that come and they're exhausted, they're tired. Some of them are really broken. Like I said, many of them haven't slept, not eating well. Their own physical health is ignored or put second place. And it's just listening to everything that you've said because they're already operating on a very fragile level. And I can't remember the number of times I've had to say to families, you need to see your doctor because, and they say, no, no, I'm fine, I'm fine. I say, you need to see your doctor because I can see from where they are, they're just at the end. And I think one message from this conversation is families don't need to get to that stage. We need to be well to be able to support these lovely children who have so much to give. So I really hope that parents can listen to this and come out of it feeling positive to know that, there is hope and there is a way. It's about reframing some of those thoughts and how they've been made to feel that the expectation I've got to have this child that fits this description. That amazing. Great. It's been an amazing session, and I'm so thankful for you sharing your great work and just sharing from your lived experience with our audience today. And just want to ask, how can our audience connect? Because I'm sure many families listening to this would want to find out more. How can they connect with you?
Yes, I'd love to meet anyone. I offer a free 15-minute chat to anyone who's interested, even if you don't want to end up working with me, just to feel heard for 15 minutes. I'll offer that until I can't anymore. You can go to my website. It's therootedcoop.com. You can, like I said, there's a button on there. You can schedule yourself a little chat with me and I can hear more and then maybe offer working with me or a referral to someone else if that's a better match. I love working one on one with parents, with families. I work with neurodivergent adults as well. I also have some courses that introduce people to the information if they'd like to just take a bit of the information. First, I have a free one and then one that's paid and one that's kind of in between. I also have a YouTube channel that's also the Rooted Co-op. And on there, I share sort of everything that we talked about today and then some of my just ramblings about life. So you can find playlists on nervous system exercises, on understanding polyvagal theory, on some neurodivergent affirming concepts, on distress tolerance skills. And I think I have a playlist on parenting on all sorts of topics. So that's free and available for folks. I'm doing my best to get as much out there as I can so it can be really accessible.
Thank you so much. We will put these resources. We will put them along with the podcast so that people
Thank you.
listening can access these resources as well. So thank you so much. We're really pleased that we had this opportunity to have this conversation because I've learned so much that would be so useful for the families I see, and it's going to help my consultations as well, coming from that point of just reframing. So it's not just for families, it's also helping clinicians to think as well, because I think just being able to speak to parents to reassure them and give them some positive words will go a long way. So thank you so much for your time, Gazet. We're so grateful. Thank you.
Thank you as well for your beautiful work and your open heart.
Thank you. Thank you.